What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Today we're going to discuss about the sphenoid bone, one among the beautiful bones in the human body, and what a bone this is. And this bone is so special because it articulates with all other bones of the cranial cavity, and this is so unique. But I always like to go back to square one, to where all the things begin. And we saw that we have the skull, and the skull is formed of 22 bones. This is to exclude the ear oscars, and we said out of these 22 bones, 8 of them are called cranial bones because they're forming the housing of the brain. And out of these 8, we have one bone which is unpaired, and it's called sphenoid bone, and this is the topic of discussion today. And we said the other time, this bone can be viewed from the lateral aspect of the skull, and this is just a part of it which is called the greater wing of the sphenoid bone. This is the greater wing of the sphenoid bone, and we also have another greater wing on the other side, and then the body is found inside the cranial cavity because it forms the the keystone of the cranial cavity. So this is the sphenoid bone, and the word sphenoid actually means wedge shaped, and it has got the shape of the butterfly, and you can see has got the wings. Also the butterfly got wings. But I don't know why the picture of, whenever I'm thinking of sphenoid bone, the picture of drone come in my mind. Whenever I'm thinking of this bone, the picture of drone comes in my mind. Like, I don't know, they resemble or something. You can all guys see, like, have a little bit, same features, the same appearance as the drone. Now, the sphenoid bone is considered the keystone of the cranial cavity. The keystone of the cranial cavity. Why? Because I've just said the sphenoid bone is the only bone of the cranial cavity that articulates with all other bones of the cranial cavity. Remember, we have 8 bones of the cranial cavity. Out of these 8, the sphenoid bone, it articulates with all other 7, and this is the sphenoid bone. This is the superior view, this is the lateral view. You see, it articulates with the ethmoid bone anteriorly, the frontal bone anteriorly. It articulates with the parietal. This is the parietal part of the parietal bone, and it articulates with the temporal bone and the occipital bone. It articulates with all other bones of the cranial cavity, and so it's considered the keystone of the cranial cavity, right? It has the center of the cranial cavity. And another important thing is that this sphenoid bone, this is in yellowish here because these pictures are coming from different textbooks. This is why we have different color codes here. Like the sphenoid in this picture is colored by green, and in this picture is colored by yellow, right? So this is sphenoid bone, and you can see sphenoid bone, apart from being the keystone of the cranial cavity, apart from uniting all the bones of the cranial cavity, it also connects the neurocranium to the visceral cranium. We said this part of the cranial cavity, this part of the skull that is housing the brain is called the neurocranium, right? And then we said this part of the skull which is covering the upper respiratory and digestive system, it's called the visceral cranium or the fascial cranium. Now you see, this sphenoid bone, it also connects with the fascial skeleton. So it connects the neurocranium to the fascial skeleton, but within the neurocranium it unites all the bones of the cranial cavity, all the bones, and this is why this bone is so special. Well, the sphenoid bone now has got the body, has got the wings and some other processes, and this is the body of sphenoid bone. This body of sphenoid bone, it is extending all the way from the ethmoid, all the way anteriorly from ethmoid bone, and lands posteriorly to connect with the occipital. This is the occipital bone. So it spans all the way from ethmoid bone to the occipital bone. This is the body of sphenoid bone, and anterior you can see, this is anterior view. Anterior you can see this bone is this body is a cube shaped, but has got the holes in it, and these holes we call them the sphenoidal air sinuses. Sphenoid air. Remember, we talked about these paranasal sinuses at some point, and we'll have to separate discussion of paranasal sinus. But one of the sinuses are found within the sphenoid bone and are called the sphenoidal air sinuses. Sphenoidal air sinuses. What do we see on the top of the body of the sphenoid? This is the top of the sphenoid bone, the top of the body of the sphenoid bone. Well, on the top of the sphenoid bone, we have a very, very, very unique feature, which is called the sella tussica. Sella tussica. Actually, the word sella means saddle or saddle, and then tussica means Turkish. Now, the sella tussica, this part is called the sella tussica, to literally means the Turkish saddle. Turkish saddle. What is your saddle? Saddle is is a seat that you use to ride your horse. This is a saddle. Why Turkish? Because the very first person to use this kind of saddle was the guy Ottoman, who was Turkish, and you see the name Ottoman is typical of Turkish. He used to this kind of saddle to ride the horse, and so this saddle is called the Turkish saddle. The Turkish saddle. What's the Turkish saddle in Latin? Is the sella tussica. And what is the sella tussica in the body of sphenoid? Is this region over here? It resembles the sella tussica in a view from the lateral view. Well, let me show you. On the lateral view, this is your sella tussica. This one, the sella tussica, and you see it's like almost behaves like almost behaves like a seat, like the saddle, a seat of your horse, where you stay to you sit to ride your horse. Now the sella tussica. Now this is the sella tussica. It has got an elevation anteriorly, elevation posteriorly, and a depression in between. Like we have elevation anteriorly, elevation posteriorly, and a depression in between. Now the elevation anteriorly is called your tuberculum sellae. That elevation anterior to the sella tussica. This is a ridge anteriorly, and then the elevation posteriorly, because it's posterior. Remember, dorsum means posterior. Is called dorsum sellae. So we have two elevations of the sella tussica. Anterior is the tuberculum sellae, posterior is the dorsum sellae. In between, we have a depression which we call the fossa. What kind of a fossa? It's called hypophyseal fossa. Now I'm introducing another terminology here, which is hypophyseal fossa. Hypophysio comes from the hypophysis, and the hypophysis is your pituitary gland. Hypophysis is pituitary. So here is where the pituitary gland sits. The pituitary gland is also called the hypophysis, and this fossa is called hypophyseal fossa, which could also be referred to pituitary fossa, because here is where the pituitary gland sits. Now you see how it resembles the sella tussica, right? One more time, we've said we have the sella tussica means the Turkish saddle, and this is the Turkish saddle, and the Turkish saddle has got two elevations and a depression in between, and your elevations are tuberculum sellae and the dorsum sellae, and the depression in between is called the hypophyseal fossa, which is also called which is housed in your pituitary gland, which is also called hypophysis. And this is the pituitary gland. Remember, the pituitary gland has got two lobes, anterior and the posterior. These are the lobes. Don't worry about them. And then we have a membrane, we have a compartment, like a partition that is covering the pituitary gland, to make sure that pituitary gland is separated from the rest of the cranial cavity, to make sure the sella tussica is separated from the rest of the cranial cavity. And because partitions, we call them diaphragm. This one is called the diaphragma sella, because it covers demarcates the sella tussica to make it a different compartment, right? Yeah, so this is the diaphragma sellae, and the diaphragma sellae is this membrane, is a dura mater. We're going to discuss about this dura. We don't know them perhaps, but it's a dura mater that compartmentalizes the hypophyseal fossa or the sella tussica from the rest of the cranial cavity. You see, like we have a different compartment here, and the rest of the cranial cavity is found away from the sella tussica, and here is your hypophysis gland, or the pituitary. One last time, we have said we have this structure at the body of the sphenoid bone, which is called the sella tussica, and the word sella tussica means Turkish saddle. Why? Because it resembles the seat where you sit to ride your horse, right? And we've said we have two elevations and depressions. Where two elevation is the one is the tuberculum sellae, and the posterior is your dorsum sellae. In between you have the hypophyseal fossa, which houses what? Yes, hypophysis, which is your pituitary gland, right? And then now anteriorly from the tuberculum sellae, we have, like laterally to the tuberculum sellae, we have horns, like projections that are coming posteriorly, and these are called crinoid processes. This is the crinoid processes. The crinoid process, we have two, one on the right and one on the left. These are for the attachment of the dura mater. We're going to see later that we have a part of dura mater which is called tentorium cerebri, right? The tentorium cerebri, the tent of the cerebellum. And the tent of cerebellum, anteriorly, it attaches to the crinoid processes. So the crinoid process is like 4 point of attachment for dura mater, and to be specific, that would be your tentorium cerebri. We're going to discuss about it. And then we'll have another depression here, which we haven't seen. is a depression just behind the tuberculum, just behind the dorsum sellae. We'll have a depression like a slope, which is called crevasse. And the word crevasse in Latin means slope. Eh? Now, let me go back to this picture here. We have said we have the tuberculum sellae, hypophyseal fossa, dorsum sellae, and then behind the dorsum sellae, we have a depression here, which this depression is called the crevasse, and you can see it supports your brainstem. I know you don't know the brainstems at this point, I mean the part of the brain, don't worry about it. And this is the brainstem, and this crevasse, it supports the brainstem, and this is why I'll emphasizing here, it supports the brainstem. Yeah, that's your body. That was the body of the sphenoid bone. Let's see other features of the sphenoid bone. The sphenoid bone has got wings, as we have said, because it's butterfly shaped, it should have wings, right? And it has got greater wings. These are the greater wings and the lesser wings. Two greater wings and the lesser and two lesser wings. Now the greater wings are forming, this is the greater wing, they are forming the part of the anterolateral part of the cranial cavity. Okay, anterolateral part of the cranial cavity, but because they will also extend to be viewed from the the lateral side of the skull, as we have seen, they are also forming the part of the lateral wall of the skull. We have seen about this. We have said so much about it, because we said they are forming the lateral part of the cranial cavity. They can be viewed from the lateral part of the skull, and we say every time we say that this is the greater wing of the sphenoid bone, this is what we are meaning here. And yeah, this is the greater wing of the sphenoid bone. And because of greater wing, we also have lesser wings, and these are the lesser wings of the sphenoid bone. The lesser wings, they are found anteriorly to the greater wing, but also superiorly. So this is the lesser wing, this one, lesser wing, and this is the greater wing. In between, you have a fissure here. We have like something separating these two wings. Now the lesser wing is found anterior and superior to the greater wing, anterior and superior to the greater wing. But we're going to see how they form the part of the orbit, the socket of the eye, the orbit or the socket of the eye. These are the two wings, the two parts of wings of the sphenoid bone. And next is gonna be the pterygoid processes. We have processes here. This is the pterygoid process, and this is the pterygoid process. The pterygoid process, it extends to where the greater wing and the body of sphenoid bone meet. You see, we have the greater wing and the body, they are meeting at this point, and at this point we have this process which is called the pterygoid process. Now the pterygoid process will form two plates. Right? We have the pterygoid process, which is coming from the junction between the greater wing and the body of sphenoid, and this process is called the pterygoid process. The pterygoid process has got two plates. It has got the medial plate of the pterygoid process and the lateral plate of the pterygoid process. Medial plate of the pterygoid process and the lateral plate of the pterygoid process. And this is the medial plate, because if you are seeing from, this is anterior view, if you are seeing from anterior view, it looks like a process, like just like a projection. But if you are looking from the inferior view, you will see like there are something like plate. You see, it's a plate, it extends all the way from here to here. This is your lateral plate of the pterygoid process, and this is your medial plate of the pterygoid processing. Now the lateral plate is very important because it's a point of attachment of the muscles of the pterygoid. The pterygoid muscles, we remember, we have medial pterygoid and the lateral pterygoid, and all the medial pterygoid and lateral pterygoid, they attach to the lateral pterygoid plate and not the medial pterygoid plate. The medial pterygoid plate, it attaches to the medial side of the lateral the medial pterygoid muscle is attached to the and medial side of the lateral pterygoid process, and the lateral pterygoid muscle is attaching to the lateral side of the lateral pterygoid. So all the pterygoid muscles, they attach to the lateral pterygoid plate and not to the medial pterygoid plate. We have seen quite enough. Let's now discuss about the foramen, which are foramina, which are found in the which are found at the sphenoid bone. And to start with, we have the optic canal. Some people refer to the optic foramen, but the canal means, remember we talked about the canal. We said the canal is traveling through the bones, like you are walking through the bones, like the tunnel through the bones, like traveling through the tunnel. That's your canal. But a foramen is a hole, like you're getting in and getting out. You're getting out to in easily. Like, you should be able to see through the foramen. For example, this one, you see, this is a foramen because you can see inside. Like you're getting in, getting out easily. But a canal, you are traveling through the bone. You are like walking through a tunnel, and that's your canal. Now, the optic canal is found here at the junction between the lesser wing and the body. I mean, the lesser wing and the body of the sphenoid bone here. And this anterior is considered the optic foramen, but it travels through the canal and is considered the optic canal. The optic canal is very important for your number one optic nerve. Optic nerve is cranial nerve number 2. So optic nerve goes through the optic canal, but goes with an artery which is called ophthalmic artery. Remember, the ophthalmic artery is the only branch of the internal carotid artery that does not go to the brain. The internal carotid artery is designated to supply the brain, with exception of the one branch which is called the ophthalmic artery, which does not go to the brain. Instead, it goes to the eye to supply the eye and the scalp anteriorly, and that's your ophthalmic artery. We also have the branches of the sympathetic nerves that are going through the eye. To the eye through the optic canal. Remember, we have ophthalmic artery going through the optic canal and not vein. The ophthalmic vein does not go through the optic canal, Next, it's gonna be your superior orbital fissure, and the superior orbital fissure is this triangular slit which is formed between the lesser wing and the greater wing of the sphenoid bone. The lesser and the greater wing will have a triangular slit, which is called the superior orbital fissure. You can all guess from the word orbital fissure. So fissure is something like a gap which is right between, and this is the superior orbital fissure. Now, what goes, and orbital means goes to the eye, right? So most of the structures that are passing through the superior orbital fissure are going to the eye to supply different parts of the eye. What are the contents? Now we have nerves. We have number one. Let's talk with the nerves. We have the nerve. Let me start with artery, with the vein. We've said here that the ophthalmic artery is going through the optic canal. Now the ophthalmic vein is going through the superior orbital fissure. You should always keep that in your mind. Like the superior orbital fissure, it will be for your ophthalmic vein, and the optic canal will be for your ophthalmic artery. They are not going within the same path. But the nerves are very important in the superior orbital fissure, because the nerves that are going to supply the muscles, extraocular muscles that move the eyeball, are passing through the superior orbital fissure and together with another nerve. Now, what are the nerves that are found in the superior orbital fissure? Number one is cranial nerve of 3, which is oculomotor nerve. Cranial nerve of 4, which is the trochlear nerve. V1, first branch of trigeminal nerve, and cranial nerve number 6. Let me do it one more time. We have said nerves that are passing through the superior orbital fissure. Number 1 is cranial nerve number 3, cranial nerve number 4, first branch of number 5. Only V1 is passing through superior orbital fissure, and then number 6. So easily you can say 3, 4, 6, and the first branch of number 5, which is V1. V1 is your ophthalmic nerve, and they're all passing through the superior orbital fissure. Now I want you to treat this region in 3 dimensions, and let's have an insight of this, how it looks like when you put bird in the orbit. We have said we have a slit here, the triangular slit, which is between the greater and lesser wing. This is the greater wing and the lesser wing of sphenoid bone, and this slit is called the superior orbital fissure, because we have inferior orbital fissure. Don't worry about the inferior orbital fissure at this moment. And what goes through the superior orbital fissure? Number 1 is your vein, which is the ophthalmic vein. Remember, the ophthalmic artery is going through the optic canal. And what are the nerves? Number 1, the nerves is 3, 4, V1 and 6, or 3, 4, 6 and V1. Remember, it's only one branch of trigeminal nerve that is passing through the superior orbital fissure. The rest, they have their own way of exiting the skull. And let's see, number 1 is the foramen rotundum. Now we're going to the branches of the trigeminal nerve. We have seen the first branch of trigeminal nerve, which is V1, is passing through the superior orbital fissure. Now the second branch of trigeminal nerve, which is called the maxillary branch, is passing through the foramen rotundum. What is the meaning of rotundum? Rotundum means rounded. So this is a rounded foramen, and this is foramen somewhere here is called the foramen rotundum. And this is superior view. This is the anterior view that it passes here through this bone, part of the sphenoid bone, and is where the lesser wing of the body are meeting at this point. They are forming this foramen rotundum. Foramen rotundum. Okay, what passes through the foramen rotundum? Number one is maxillary branch of trigeminal nerve, which is your V2, but also got an artery, which is called the artery of the foramen rotundum. The artery of the foramen rotundum. What are the veins that are passing through the foramen rotundum? It's your medullary vein, but you should not forget about the maxillary branch of trigeminal nerve, which is your V2, passing through the foramen rotundum. Next, now we have a foramen here. Look at this foramen. What is the shape of this foramen? Oval, right? Yes. So this foramen is called the foramen ovale, and the word ovale means oval. So it's a foramen, is an oval foramen. I know you remember about the foramen ovale in your heart, in the fetal circulation, and that is oval. It's ovale because it's oval shaped, and this also is ovale because it's oval shaped. Is very, very, very important. It's found at the base of the pterygoid process. Remember, we have the pterygoid process here, and then at the base of the pterygoid process we have a foramen here, which is oval shaped. It's called foramen ovale. What are the contents of the foramen ovale? Number one, you should not forget about your mandibular branch of trigeminal nerve, and also lesser occipital. But mandibular branch you should never ever forget. Now you can see the trigeminal nerve has got three branches. The first branch is thymic nerve, which is passing through the superior orbital fissure. The second branch is maxillary nerve, which is passing through the foramen rotundum. And then the third branch is mandibular branch of trigeminal nerve, which is V3, and it passes through the foramen ovale. So we have trigeminal nerve, but it has got different branches that are passing through different foramina to exit the cranial cavity. What are the nerves in the foramen ovale? Again, the mandibular branch of V3, and also the lesser petrosal nerve. Nerve. What about artery? Do we have arteries in the foramen ovale? Yes, we have accessory meningeal artery, which is going to supply parts of the meninges. Accessory meningeal artery. But what about veins? We also have medullary veins, and remember, medullary veins are communication between the scalp and the inside of the brain, the inside of the cranial cavity. And then we have another foramen here, which is like a spine, and it's called the spinous foramen, or foramen spinosum. Spinous foramen or foramen spinosum. What is so important, it sits at the edge, like the most posterior angle of the sphenoid. As you can see, like this greenish is the sphenoid, and this is the most posterior end. We have a foramen here, which the foramen is called the foramen spinosum. What is so important about foramen spinosum is passing of some a nerve and artery. But the very important artery, remember, is your famous middle meningeal artery. Remember, we have a middle meningeal artery which is going to supply the meninges, and damage this middle meningeal artery, rupture of the middle meningeal artery is very important because it may result into life-threatening condition, which is called the epidural hematoma. We're going to discuss about epidural hematoma, but we said part of the a branch of middle meningeal artery will go through the talion here, and when someone has got a fracture of the talion, can result into rupture of this artery, resulting into devastating life situation, which is called epidural hematoma. We also have another nerve. We also have a nerve that is passing through the foramen spinosum, and this nerve is called the meningeal branch of mandibular nerve. Meningeal branch of mandibular nerve is also called the nervus spinosus, and this nerve is going through the foramen spinosum. Foramen spinosum. You guys remember we have seen foramen ovale. And we've said A foramen ovale is for your mandibular branch of trigeminal nerve. Once the mandibular branch of trigeminal nerve is getting out of the cranial cavity through the foramen ovale, immediately it gives another branch which is going to supply the meninges, and this branch is called the meningeal branch of the mandibular nerve, or which also could be called the nervus spinosus, and it's going through the foramen spinosum to go back to the cranial cavity to supply the meninges. The meninges are your dura, arachnoid, and the pia mater, and they are being supplied by one branch which is called the meningeal branch of the mandibular nerve. So the mandibular nerve is going through the foramen ovale, and then immediately after going through the foramen ovale to the pterygoid region, it gives a branch which goes back. It would be referred as a recurrent, as a recurrent branch, but don't call that recurrent, because the recurrent is an artery, and this nerve is called the meningeal branch of mandibular nerve, or meningeal branch of V3. And then we have also meningeal vein, which is going through the foramen spinosum. Now, the foramen spinosum will transmit the middle meningeal artery, the middle meningeal vein, and the meningeal branch of the mandibular nerve of the three. And this is purely sensory. It's going to supply the sensation of your meninges, and that's your dura, arachnoid, and the pia mater. Last, you have a foramen here which is called the foramen lacerum. This is the foramen lacerum, and the word lacerum means lacerated. Why lacerated? Because this one is a little bit like irregularly shaped. It's like jagged a little bit, has got no shape, irregular, and this is why it's considered as lacerated. Like how it was formed is by laceration. You don't know. This is how this bone, this foramen is formed, and it's called the foramen lacerum. Now, the foramen lacerum is not really found within the sphenoid bone, but it's junction between the sphenoid bone and the temporal bone, because this is the foramen lacerum. You see, posteriorly you have this temporal bone, and anteriorly you have a sphenoid bone, and are forming this foramen lacerum, which is a lacerated foramen. Now, the foramen lacerum in live individuals, in you and I, like live individuals, usually covered by the fibrocartilage, and it's not really a foramen in live individuals. It's not really a foramen, but something like covered by fibrocartilaginous, and so it is called a false foramen. False foramen. Why? Because it's usually covered by the fibrocartilage in live individual. But sometimes it transmits the branch of the ascending pharyngeal artery. Remember the ascending pharyngeal artery. And then what is so important to note here is that it is related to internal carotid artery, but it does not transmit the internal carotid artery. The internal carotid artery does not pass through the foramen lacerum, but it is passing above the foramen lacerum. We will see that later we have like the carotid canal, which is for your internal carotid artery, and then after the internal carotid artery goes through the cranial cavity, and after passing through the optic canal to enter the cranial cavity, it will be related to the foramen lacerum here, but it does not. It passes above, like travels above together with the greater petrosal and the deep petrosal nerve, but it does not go through the foramen lacerum, or your lacerated foramen. Now you can see we have a lot of the foramina in the cranial cavity, and most of them are found within the sphenoid bone. Now by understanding the sphenoid bone, you already covered maybe 50% of the foramina of the cranial cavity. Remember, we have seen like 5 foramina, 5 on this side and 5 on the other side, and so it covers a lot of this foramina of the cranial cavity, and that's your foramen. That's your sphenoid bone. Very, very unique bone, and very, very important bone to keep into your immediate attention. We've said we have the orbital fissures, and now we want to see the relationship between the sphenoid bone and the orbit, the socket of your eye. The sphenoid bone is forming part of the posterior part of the orbit, like the posterior wall of the orbit, but it also forms the lateral. It also forms the side walls, the lateral walls, and this is your sphenoid bone in your orbit. But also these pterygoid processes, they are forming like the superior part of the nasal cavity, right? The superior lateral part of the nasal cavity. We're going to discuss about the nasal cavity at some point. And lastly, we'll have the sphenoidal air sinuses. Remember, we have the paranasal sinuses within the bones of the skull, and one of them they are found within the sphenoid, and it's called the sphenoid air sinus. We're going to discuss the nasal cavity, and we'll see how the sphenoid sinus drains to different parts. And yeah, it was quite an good moment having this discussion with you. But you guys, if you have a question, additional comment, you can always write me an email. You can always put your suggestions, and you have Instagram and TikTok account. Make sure you scroll here, and see you very soon.